Hi, my name is Beth Boynton. I'm a nurse consultant and author of the book Confident Voices, The Nurse's Guide to Improving Communication and Creating Positive Workplaces. I'd like to talk with you today briefly on this YouTube and tell you about 3 questions that drive my work. And I'd also like to invite you to take a look at my website and explore the services and products that I offer. The 3 questions that come to mind that describe pretty much everything I do is 1, why is communication and collaboration so important in healthcare? 2, why is it so hard for us? And 3, what role should leaders take in helping us become more effective communicators? So the first question, why is positive communication and optimal collaboration so important in healthcare? Well, I believe that if we make efforts to improve our communication and strive to work more effectively together, that we can impact every single problem we face in healthcare. The kinds of problems that I'm talking about are workplace violence, the cost of financing healthcare, job satisfaction, and of course, patient safety. Did you know that communication failure, according to the Joint Commission, is cited as the leading root cause to sentinel events, also known as adverse events, in healthcare? And this is true year after year after year. When we're communicating effectively together, we're speaking up about concerns, we're setting limits, we're listening to each other respectfully, and we're showing ownership towards problems and solutions. The second question I'd like to talk about briefly is why is it so hard for us in healthcare to improve our collaboration and improve our communication? Well, there's lots of external aspects to making those changes. The stress that we live in, gender differences perhaps, the old hierarchy that we've existed in for so long. But the underlying point that I think is important in this question is that it's so hard to change because we're changing our behavior. It's not intellectual learning that we have to focus on. It's changes in our behavior, in our own behavior and in our behavior together. So that ultimately respectful communication and collaboration will emerge as we have more healthy relationships in our workplaces. Things like checklists and communication models like SBAR and GER and engineering safety devices are all important aspects of creating a safe and just culture for our patients. But I don't think that they take us far enough into changing the underlying dynamic that we have as healthcare providers. And if we want to create meaningful and long-term change, I believe that we have to get at that underlying dynamic. Things like setting limits, receiving and giving constructive feedback, building self-esteem, and identifying inappropriate behavior are all really hard aspects of this kind of work. And that's why a simple training into the intellectual aspects of assertiveness or the intellectual aspects of listening aren't enough. The third question that I'd like to talk about a little bit is what is the role of healthcare leaders in creating positive workplaces and building the skills in staff that will help them to communicate more effectively. That role is a crucial role. The things that leaders must be willing to do, and I refer to leaders at all levels, from senior leadership to the staff nurse who may be supervising support staff. But trust has to be built. It has to be built in places where it has been broken. We have to acknowledge that inappropriate behavior has occurred in the past, and we have to be able to identify it in the present. Leaders must be willing to help establish clear expectations about behavior. They must be willing to role model respectful communication and advocate for resources. Some of those resources might be training, some of the intellectual things that I was referring to earlier. Some may be time, so that there can be opportunities to practice these new skills. and to give each other feedback on where we're doing a good job and where we could do a better job. We must realize that there will be a learning curve, and yet leaders must also be ready to enforce inappropriate behaviors when they occur. Recently, as a staff nurse, I still do a little bit of per diem. I was concerned about an unsafe staffing situation. And I went home one night very upset. I knew I had to address it. After all, I'm a consultant with communication and behavioral issues in healthcare. And I want to share with you that addressing that issue, first with my supervisor, then with the scheduler, and later ultimately with the director of nurses, was an extremely difficult process for me to follow. And I say that because I have written a book, I have a graduate degree, I've been a nurse for 25 years, and yet the changes that we're asking staff nurses and others to make is extremely hard. And so leaders that will help us make those changes are going to make a huge difference in whether we're successful or not. Thanks for listening. These concepts are really complicated and there are many layers to them, and this is just an overview. There's lots more at my website. I'm always happy to answer questions, and I believe that we can make healthcare a safer and more humane service that is cost effective and actually enjoyable to work in. Take care.